Hello everyone, my name is Akshita Agarwal and the topic for today's video is anemia or and iron. So I'll be discussing different aspects about iron, and I hope that you will get answers to many queries related to iron and anemia. So let's start with discussing that how do you know that you have anemia or you might have iron deficiency. So what are the key symptoms that you need to know? First is that you might experience lack of energy. You might feel low, might feel drained. There can be constant fatigue that you can experience. Second is loss of appetite. Third can be massive hair fall and poor quality of skin. Fourth can be constipation. Next is you may have irregular periods. Then there can be irritation and depressive thoughts. Even depression has been associated with iron deficiency. Next can be there is this component which is known as ESR, which is it is usually present in your CBC complete blood count report. When you have iron deficiency, your ESR goes up, and when the ESR goes up, you might experience unresolved body pains. You may have sufficient vitamin D, you may have sufficient calcium, yet you might have body pains. So please get your ESR checked at that time. Maybe you are iron deficient and maybe your ESR has gone up. Now other symptoms that you can feel is one of the one more feature symptom which is very important is pica. Now sometimes especially during pregnancy and when the children are growing up, since their iron needs are very high, what happens is that they experience craving for non-edible items, like they might want to eat chalk, they might want to eat paper, they might want to eat cardboard. So people attribute it to calcium deficiency and they start on calcium supplements, but it is actually iron deficiency and it is known as pica. So if you know anybody who's showing such symptoms, please check their iron levels and give them iron supplementation. Now these are few symptoms that you might feel. They can be lack of concentration. You're trying very hard to concentrate on the studies, but you're not able to, so you may be iron deficient. So now let's talk about why does it happen, why do we get iron deficient. So first cause can be poor dietary source. So you are not taking sufficient iron from your diet. That can be the primary reason for iron deficiency. Now iron can be of two types. It can be of heme category or non-heme category. Now the heme iron is easier for the body to absorb. It is a fast absorbing iron form, and non-heme irons are comparatively difficult for the body to absorb. So heme iron is present mostly in non-vegetarian sources, and non-heme iron is present in mostly vegetarian sources. That is the reason that the absorption of iron is lower than in vegetarian diets than in non-vegetarian diets. So it can be as less as 5% or even lower if you're taking it with inhibitors. Now when you are taking any source of iron, I will later in this video explain that how can you enhance its iron absorption. Second mistake that you might be making is that you might be consuming it with inhibitors. Now what is inhibitor? Inhibitor is any chemical or any product which doesn't let the iron get absorbed from the diet. So very common examples will include tannin, which is present in tea, caffeine, which is present in green tea and coffee. Then calcium. Calcium and iron, when they are present in a same meal, they don't let each other get absorbed. Common example is palak paneer. Palak paneer preparation is a useless preparation when it comes to calcium and iron absorption. Now another example of this inhibitor is oxalate. Now oxalates are present in green leafy vegetables. Again, palak paneer is a very good example in which you can see that why they can't let the iron get absorbed. So another example of this can be some people are taking nuts with their tea. So they take almonds and walnuts first thing in the morning with their tea, but the tannin present in the tea will not let the iron from these nuts get absorbed in the body. So please don't take them together. So this is all about inhibitors. Now moving on is third reason can be excessive sweating. Some people are very active physically, they are into sports, they can be athletes, so they have a higher tendency of losing iron, because iron can be lost through sweat as well. Some people have a higher sweating tendency generally also, even they are at a risk of high iron losses. Another reason for iron deficiency can be stomach worms. Some people have worms in their gut, and they don't let the iron get absorbed. So these people need to be careful, and they need to deworm themselves every 6 months. Now, how does deworming take place? There is a tablet or a liquid available with the chemist, and you can go to the chemist and ask for it. Once you take this liquid, all the worms that are present in your stomach will be cleaned in your motion, and you have to repeat this cycle every 6 months for adults, and for children every 3 months. So last reason that can be there for poor iron absorption can be indigestion. Most of the people are suffering from some or the other form of indigestion. They may be having acidity or constipation, gas. So all these also doesn't don't let the iron from the diet get absorbed properly, and they may end up having a iron deficiency. So now I am going to give you a few tips which can help you in improving the absorption of iron from your diet. First is include some source of vitamin C with your main meals. That is your breakfast, lunch and dinner. They will help in absorbing iron in a more effective way, even if you are a vegetarian. So I have done a detailed video on vitamin C, where you can find all the sources from which you can get vitamin C and incorporate them in your diet. Second thing is that try to avoid inhibitors with your main meals. So don't take tea and coffee with your breakfast or with your lunch or dinner. Many people have this bad habit of taking tea with their meals, but try to space them out at a gap of 1 hour. So say you want to have your lunch at 2 p.m. So from 1 to 3 p.m., don't have any tea or coffee. Take it before 1 p.m. or after 3 p.m. Okay? Don't couple your nuts with your tea. Don't couple your seeds with your tea. Don't couple your meals with your tea or coffee. They will not let the iron get absorbed. This stands true even with green tea, because green tea also has caffeine. Now another thing that you can do is that when you are like for the sources of iron, some people consider apple as a very good source of iron. It is a general saying that when you cut apple it turns brown because of the presence of iron. So I would like to clarify here that apple is a very poor source of iron, first of all. Secondly, why does it turn brown? Because it gets oxidized. When you cut it, the surface, the compounds present on the surface, they, in the presence of oxygen, they turn brown. And this is known as oxidative browning, and it has nothing to do with iron. So please, if you are relying on apple as a source of iron in your diet, stop taking, you need to take more sources of iron in your diet. Apple is not at all a rich source of iron. You need to bear that in your mind. Next is, when you want to enhance iron from your diets, you want to take more iron from your diets, make sure that you are not taking your supplementation of either iron or calcium before and after that meal. So if you took a iron rich meal in your lunch and you followed it up with taking a calcium supplement, it will not be able to absorb it, because calcium will not let this iron get absorbed from the diet. So these are few things that you can keep in mind. Then try to take more probiotics in your diet, which are rich, which are present in curd. So probiotics will help enhancing your digestion. When your digestion will be good, it will be easier for your body to absorb iron. Now some people who are deficient in vitamin B12 are also seen to have poor levels of iron. This happens because when you have poor B12, then the friendly bacteria, they are not able to multiply. And when they are not able to multiply, the digestion suffers. So when the digestion suffers, the iron level automatically is not able to absorb to the extent it can be. So these are few tips that you can use in your diet, to improve the iron levels. Now next are the sources. Let's talk about the sources of iron. So for vegetarians, the good sources of iron can be nuts, So in nuts you can take almonds, walnuts, raisins, dates. They are excellent sources of iron. Then in grains you can take bajra. Bajra is a very good source of iron. In dals you can take soya bean, and you can take kala chana or your Bengal black Bengal gram. It is also very very rich in iron. Then moving on to your fruits, like I said, apple is not a rich source, but watermelon is a very very good source. Then coming on to your vegetables, palak and beetroot are exceptionally good sources of iron that you can incorporate in your diet. Beetroot, I've tried myself. It shows excellent result with increasing your hemoglobin level. Now, moving on to the non-vegetarian sources. So the non-vegetarian people can take all the sources that I recommended for a vegetarian, along with taking, organ meats like liver or mutton. They are also very very good sources of heme iron, which is the best form of iron for your body. But one word of caution here, that lean meats are always preferred and prescribed in the diets, because they have lesser fat and they are more healthier and better sources of protein. So when you're taking red meats and you're taking organ meats, please don't take them in excess, because they might give you a big load of cholesterol. They might give you a lot of fat. So consume them in moderation. Also take other sources of iron. And when you are severely deficient in iron, please take a supplement rather than only relying on the diet. I hope this video has helped you in gaining some perspective about iron and anemia. And I will see you in the next video. If you like this video, please subscribe to my channel and share it with your friends and family. Thank you.